Welcome to Coyote's SmartPuck in a Snap mini-series on all the essentials necessary to start fitting a SmartPuck elevated vacuum system with your patient. The SmartPuck from Coyote is an electric elevated vacuum pump intended for lower extremity prosthetic users. It is currently IP28 water tested, meaning it can go up to 10 feet or 3 meters submerged for up to 12 hours. It is not indicated for use in saltwater, murky water, swimming pools, hot tubs, or other corrosive environments. Currently, it has a 300-pound weight rating, or 136 kilograms, and just under a 2-inch or 5-centimeter build height. There is a 12-month warranty. If practicing in the United States, the SmartPuck is coded as an L5781, and if using a molded distal cushion, the L5668 can be utilized. It is important to note that for best practices, documentation for using elevated vacuum requires a history of volume fluctuation, excessive moisture, or a history of wounds to be documented according to many insurance requirements. What separates the SmartPuck from many other vacuum systems on the market is the drop-in setup. The SmartPuck drops into the socket and provides the ability to have no additional need for puncturing the socket wall with a type of barb or any other hosing. It also eliminates the need for a special lamination plate on the bottom to accommodate for vacuum. This simple drop-in setup ensures there are no leaks in the socket walls. Leaks in the socket walls have historically caused frustration when fitting a patient. However, this unique drop-in design allows for very simple fitting and fabrication. The SmartPuck registers the internal and external atmospheric pressures within the socket. If the SmartPuck registers more than 1.5 inches of change in pressure, it will activate the pump to ensure stable volume. Your patient may experience the puck turning on more frequently on their limb because their limb needs to accommodate to being under a vacuum system. Over time, the patient should be able to hear the puck turn on less and less frequently throughout the day, as long as the suspension sleeve and liner are well fitting and the patient's managing any other volume concerns appropriately. The SmartPuck should be charged nightly, however, can last on average between 2 and 3 days. When going to charge the SmartPuck, there is a red dot on both the puck itself and the charger. These line up in one direction only for charging. On the box on the charger that is connected when you plug into the wall, you will see a light on this box. If the light is a solid amber color, that means the puck is still charging. When the light turns a full green, this means that the charging is complete, which takes approximately 5 to 6 hours. You can see the exact percentage of the charge of the SmartPuck in the SmartPuck app. The SmartPuck app is available for both Apple and Android products. In order to pair your puck, you'll go to the pair screen and ensure that your device's Bluetooth is turned on and that your puck is fully charged. Under the scan, you'll hit scan and the puck will show up. There will be a radio ID on the puck, which should correlate to the same radio ID on the screen. Click pair and choose right or left to connect. In order to set the amount of vacuum pressure, you will want to go to the presets page. You can tap sit, walk, and sport pressures and indicate the amount of vacuum setting you would like for each one. In the beginning, you may want to consider keeping all of these pressures the same so that the patient doesn't inadvertently change to a setting too high or too low. Patients do have access to this app, so be sure that a full education is performed and they understand how to properly go from mode to mode. There is an additional video that entails the full programming of the SmartPuck. There is an About screen that shows other features of the app as well. Let's go into our home screen where we can take a look at the different sit, walk, and sport modes. On our home screen, you will see that we have a sit, walk, and sport mode. You can also toggle between left and right side for individual programming if there is an individual who has bilateral SmartPucks. When we choose the sit function, this has already been preset for how much pressure we want each of these settings to be. So for this case, we have our sit vacuum set at 4. The user will hit the sit button and then set vacuum to 4, which will put the SmartPuck into the sit setting. On this screen, you will also be able to tell what the vacuum setting is and what the actual pressure is reading. You may see at times that the actual pressure is reading slightly higher than the vacuum setting. This can be very typical. Sitting features usually are for when a patient is needing to have a more quiet environment, perhaps in a religious setting or office setting, or they may not want to have as much tightness around the knee, perhaps while driving. Typically, we see users appreciate between 8 to 12 for their walk settings. Again, this is varied for each individual user, but we don't want to put a patient in too high of a vacuum setting, especially when they are new. We want to ensure that their limb can tolerate the vacuum pressure at lower increments and then gradually increase those to a more appropriate setting as they become more and more comfortable. If a patient wanted to touch the walk and then set vacuum to 8, their SmartPuck would then be in the walk setting and the vacuum would be set to 8. Sport mode can be utilized for individuals who are doing higher activity levels and want to have more of an increased hold during those specific times. The puck can be programmed all the way up to 24, which is the maximum value. However, that's a quite unusual setting to have. Majority of patients for their sport activities appreciate somewhere typically between 12 and 14. On the screen as well, you can see if the SmartPuck is connected or disconnected. You can also turn your SmartPuck on or off and see the exact battery life present. In order to go from having the SmartPuck in sport mode and pulling higher to then a lower setting, the patient will need to introduce air into the system somehow to allow this pressure to release. So they would want to turn off the SmartPuck and slightly roll down their outer suspension sleeve to allow air into the system to go into a lower pressure setting. If a patient does not always want to utilize the SmartPuck app, the SmartPuck comes with a magnet on-off key, which helps to power a Hall switch. A Hall switch is an internal feature of the SmartPuck that does not have a physical button on the outside, but rather is turned on and off through a magnet. You will see a Hall switch sticker on your SmartPuck before installing. If you hover the magnet over this region, you will hear one vibration indicating that the SmartPuck has been turned on, and then if you hover it again, you'll hear 2 vibrations indicating that the SmartPuck is turned off. If you hover the magnet over the Hall switch for 10 seconds and hold it for 10 to 12 seconds, this will reset the Bluetooth. This may be necessary if the Bluetooth has become completely disconnected from the SmartPuck to the device. This can happen if the SmartPuck has completely died and needs to be charged. The SmartPuck will remember the last setting used when you are using the magnet on-off key. So if the patient takes their prosthesis off and had turned the puck off in walk mode, then when they turn the prosthesis and the SmartPuck back on, it will again still be in walk mode. In order to change the modes, you will need to go into the app to change your settings. The opening for the charge port can be placed in any orientation on the socket depending on patient and clinician preference, so medial, lateral, anterior, or posterior. However, majority of the time clinicians and patients choose to put the charge port on the medial aspect of the socket, similar to where a typical push button is on a locking mechanism. The Hall switch is located approximately 1 inch or 2.5 centimeters to the right of the charge port. We will now look at some of the simple fabrication steps. However, your SmartPuck will come with a fabrication guide. This guide is also available on Coyote's website under the SmartPuck page. Be sure that you go through these instructions quite carefully when doing the fabrication, and feel free to reach out to our educational, technical, or sales team at any point for questions. The SmartPuck has its own dummy, the AP-100MD combo molding dummy. This dummy is used for both the SmartPuck and AirPuck check socket fittings as well as final laminations. The dummy should be utilized to ensure a proper seal around the SmartPuck so there is no air leakage. We do recommend using a thermal unstiff or trans-stiff to ensure proper sealing and for an optimized fitting process with a solid material. The dummy should be placed onto the model and no plaster should go over the scribed line or anywhere on the dummy. This will ensure you have a very snug fit of the gasket around your socket when fitting. You can also use 3D printing techniques for when using a SmartPuck. Maintenance is very easy with the SmartPuck. There is a filter disc that is put on top to reduce debris from getting pulled into the vacuum system. You should replace this filter disc monthly or sooner if obviously wet or soiled. 12 come in a package when purchased with a SmartPuck. Do not try to take apart the SmartPuck, especially if you notice any debris, as loaners are available to be provided to ensure that proper maintenance can be performed if there are concerns with the function. A patient should be shown how to replace their filter disc, and the filter disc should always be the item immediately on top of the SmartPuck in the system. Although quite simple, there are some important steps to ensure you follow when installing the SmartPuck. There is Molykote packet of lubricant that is provided with each SmartPuck purchase. You'll want to ensure you use this specific lubricant on the gasket, as it helps the gasket not to break down over time like other lubricants can. This will ensure a long-lasting gasket and minimize air holes or air leak risks. You'll place the SmartPuck into the socket with the red dot facing up. This is the primary intake filter where all of the air is pulled out of the socket. You can use a 4mm wrench and put it into one of the screw holes to line up your 4-hole pattern. The 4 holes from the SmartPuck should line up with the 4 holes drilled in the bottom of your socket. Evenly push the SmartPuck down with your hand from inside the socket and use screws to assist in pulling it down evenly. We want to ensure that it is pulled very evenly and all the way down, and a solid band of compression is seen around your SmartPuck. This may take a little firmness from your hand to push it in tightly, as there is a snug seal to ensure no air leakage. There will be excess lubrication on the outside rim of the SmartPuck and along the inside of the socket wall. Carefully wipe out the excess lubricant, but do not drag it across the face of the puck to ensure you do not clog that red intake filter. You will need to ensure that there is an air exhaust hole drilled in the bottom of your check socket or definitive lamination. This will ensure that air is able to exit the system. It's also recommended to use a distal attachment that has a center hole. Be sure to, again, place a filter disc over the SmartPuck as it protects that primary intake section. You'll want to make sure that you place it shiny side up with the felt side down on the white filter micron disc. When removing the SmartPuck, there is again a few simple steps to ensure that it is removed properly. You are to remove all the components from the bottom of your prosthesis. Then you are going to put long screws into the SmartPuck where they are bottomed out and cannot screw in any further. You can do all 4 or 2 diagonally from each other. After this, you're going to place the socket on the floor and slowly push your body weight into the socket. This will allow the SmartPuck to come up and out of the socket quite easily. Note, you do not want to tap anything in the center hole of the socket. This will cause hitting the SmartPuck, which will damage the electronics, including the Bluetooth, battery, and the pump of the socket. It will leave marks on the outside of the socket, which will indicate that this has been done. This will void your warranty. You may need to put longer screws in to assist with getting the puck out, or for the final little bit that needs to be pushed out, you can use a 4mm wrench to help the last little bit to be able to pull the puck out with your hands from the top of the socket. But again, nothing going through the center hole to tap the puck out. When fitting elevated vacuum, it is essential that the patient have distal end contact. We want to ensure patients have some form of distal support or cushion. We do have a prefabricated distal cushion option available for ordering that has 2 different thicknesses of a silicone distal cushion specifically made to go right on top of the SmartPuck with the filter disc in between. 2 come in a pack, one being 6mm in thickness and the other 12mm in thickness. These are stackable for a total of 18mm thickness if necessary for your patient. Some patients with more bony distal anatomy or a unique shape may need to have a custom distal injection done. We have the ability to very easily make a custom distal cushion for our patients. We have a distal injection tool which allows you to drop it into your socket and do a silicone injection into the bottom. This helps to save time, improve the fit, as well as still have visibility of the distal end during the entire check socket fitting process. This also ensures optimal distal end contact, which is very essential to help prevent skin irritations from a lack of distal end contact, helping the liners last longer and reduce risk of verrucous hypoplasia. The custom distal cushion takes only 5 minutes to make. You'll want to prep the liner and protect it with some sort of cling film or plastic covering. Then you will have the patient put on a very thin nylon. This will allow the silicone, once injected, to bond to the nylon and have a little bit of reinforcement. You will use an EcoFlex 5 or similar 2-part silicone when doing this injection. This silicone can be found through many various orthotic and prosthetic distributors. This silicone cures in under 5 minutes, and you'll want to ensure that you do not put too much silicone in and cause your patient's limb to rise up and out of the socket. So ensure that you're not pushing the patient's limb out by adding too much silicone. You'll be able to pull out the distal injection tool once it has cured and cut off the excess silicone that will be coming out through the tool. It's a self-cleaning tool that will easily allow for removing all of the silicone from it for next time use. Once you've trimmed off the excess, you will punch a hole in the center to ensure that you have optimal airflow from your SmartPuck device. For your check socket fitting, you'll be able to install your SmartPuck, place your filter disc, and then place your custom distal cushion or whatever distal cushion you are using for your patient. You're able to use other distal cushions or interflexible materials. Just ensure that there is a hole that allows for proper airflow between your patient's limb and their liner and the SmartPuck. If you have an inner flexible, make sure you've drilled a hole in it as well on the bottom. If you're using any kind of distal end pad, make sure some type of center hole has been punched to allow for air to flow properly. Ensure that your outer suspension sleeve is snug against the outer socket wall. This will allow you to always have a visual of your patient's distal end to ensure that enough but not too much distal contact is occurring. In order to have space for a custom distal injection to be performed, you will want to add a little bit of material. So typically, I recommend offsetting the dummy and backfilling it with plaster, about 3/16 of an inch, to allow for this space to be injected, or approximately 5 to 6 millimeters. See our full webinar and instructions on how to do this step. When utilizing the SmartPuck, it's important to note these essential details. Only suspension sleeves should be used and not seal-in liners at this time with the SmartPuck. There is no expulsion valve which will allow air back into the socket. And so if someone were to utilize a seal-in liner, they could possibly get stuck in the prosthesis and have to use some type of shim to remove their limb out of the prosthesis. If you're interested in using a seal-in liner, be sure to check out our AirPuck or ZeroPuck options, which do allow for seal-in liners to be easily used. We also do not suggest using a carbon in the lamination for their full lamination, but rather a Coyote composite, which laminates very similarly. Carbon is conductive and can cause Bluetooth connectivity issues with any type of Bluetooth device in orthotics and prosthetics, so using a composite material or similar is essential for ensuring smooth and consistent Bluetooth function. We are more than happy to send you a sample of the Coyote composite to allow you to ensure full confidence when doing your laminations for the SmartPuck. The main problem that we see sometimes technicians will starve the Coyote composite and not allow enough of the resin to saturate through. Again, we're more than happy to send you a sample and help talk through any lamination questions or concerns. However, for the most part, it fabricates very, very similarly to carbon. It also is not as itchy and makes for a more comfortable fabrication experience due to the particles being a different type of material. We have several other videos regarding the Coyote composite, and again, more than happy to send you some. Additionally, Coyote offers central fabrication services, so if you are concerned about laminating with a different product for the first time, feel free to reach out to our technicians to have them perform the job themselves or to walk you through any of the steps. Regarding liners, it is recommended to use some type of urethane or silicone liner, as TPE liners tend to break down faster over periods of extended use with vacuum and do not flow as much as other materials. When utilizing a liner that does not have any fabric on the outside, it's important to use a small sheath to ensure proper airflow can occur throughout the prosthesis. When using a liner that has fabric, no sheath is necessarily needed unless you are struggling to get airflow all throughout, but you do want to ensure that you reflect the top couple inches down and have your outer suspension sleeve sealing to the gel on the liner as shown in the picture. This will help minimize the amount of time the puck turns on for the patient. If a patient is complaining that their puck is turning on very frequently, check this area because this may be a spot where they are getting air leakage. Sometimes when we seal the outer suspension sleeve only to the skin, we get small air leaks which can cause a vacuum to kick on more frequently. This can happen if the thigh has some type of invagination, sweat, hair, defined musculature, or something that could cause an increase in airflow and cause a leak, subsequently causing the puck to turn on more frequently. Coyote offers a demo kit program as well when understanding if the SmartPuck or AirPuck is a good solution for you and your patient. This allows you to trial the device prior to purchasing and ensure that everyone feels comfortable moving forward with this option. Feel free to reach out to us directly to receive one of our demo kits for a 30-day trial to ensure that we feel very comfortable and that the patient understands the full function of a SmartPuck. Coyote has a full family of elevated vacuum solutions from the SmartPuck, which we discussed today, to our AirPuck, which is a non-electric option fabricated in a very similar manner, and it can be used with seal-in liners. We also have the ZeroPuck, which is an electric side-mounted elevated vacuum system when you have limited build height with your patient, and it is also a really great option for using seal-in liners. See our other videos and product pages for more information on the AirPuck and ZeroPuck. Thank you for joining us today for this SmartPuck brief overview. It's just one part of our educational options, as you can find several other videos discussing SmartPuck programming, fabrication, and different patient usages listed on our website and YouTube page. If you have any additional questions, feel free to reach out to us by phone or email, as we are more than happy to answer those. In order to access Coyote products for your patient, visit us at coyote.us/distributors to see what options are available near you and for your closest distributor. Thanks again for joining, and we'll see you next time.